Okay, good afternoon and welcome to our Learn and Share conference call. I'm Russ Derry, Director of Education for Epilepsy Foundation of Michigan, and I'll be moderating this discussion. So the topic for today is epilepsy and emotional well-being, and we're pleased to have as our speakers Dr. Elissa Patterson, who is a health psychologist, and Najda RobinsonMayer, who's a clinical social worker, and both of them work with Michigan Medicine Comprehensive Epilepsy Center. So could each of you briefly introduce yourselves, talk a bit about your clinical and research interests, and describe your experience with this topic? Dr. Patterson, do you want to start?
Sure, yeah. So I work at the University Hospital here in Ann Arbor with patients who are hospitalized medically but have some sort of a condition that could be improved through psychological or behavioral interventions. So I take an integrated mind-body approach, sometimes helping people manage anxiety when medications wouldn't be appropriate, or sometimes helping people adjust to illnesses when they get a shocking new diagnosis, or sometimes coping with existential questions. And I also work in the outpatient and inpatient multidisciplinary PNES clinic, helping people understand that diagnosis and then helping them get ready for outpatient treatment. And I use a combination of interventions, including psychotherapy, relaxation training, sometimes education about psychological principles, and oftentimes principles about cognitive and social psychology that can be helpful.
Okay, great. And Najda?
I'm a licensed clinical social worker. I've been a social worker for over 15 years, and I've been here at Michigan Medicine with the epilepsy clinic for over 4 years. I work with patients both who have epilepsy as well as patients who have psychogenic non-epileptic seizures. And my interest in working with epilepsy patients, a big part of that is assisting them, connecting them to community resources. I help problem solve with them. I provide assessments. I'm also a good resource for patients when they're going through the pre-surgical process, considering surgery for their epilepsy. Since I work solely in the neurology clinic here at Michigan Medicine, I've got expertise around this population, some of their needs, resources, barriers that they experience in multiple areas, such as vocational, social health, mental health.
Okay, great. So, people with epilepsy are at increased risk for depression and anxiety disorders, and a variety of neurological factors related to epilepsy, like genetics or neurochemical changes or structural changes, or even medication side effects, can all play a role in that association. For today's call, however, I'd like to focus more on the environmental, interpersonal, behavioral, and mental factors that influence emotional well-being. So can you both start by talking about how the unpredictable and disruptive nature of seizures themselves, along with others' reactions to them, can contribute to depression and anxiety disorders?
Yeah, there are a number of ways that the unpredictability contributes to depression and anxiety. Some of the common themes and patterns that I see with our patients in our clinic is that they start limiting going out in public, which means that they're no longer doing some of the activities that they used to do, such as going out to eat, going to a theater, music concerts, friends, parties, sometimes simple everyday things that they used to do, like walking their dog, is no longer something that sometimes they're able to do or that they enjoy doing, or they get anxious, if they could have a seizure while they're doing that and being away from home. And they also have, fear and anxiety if they did have a seizure in general, but especially if they have one while they're out in public. The idea that they could injure themselves, people staring at them, how other people would respond, being embarrassed by it in the situation. Sometimes, the possibility that ambulance could be called if it may not be necessary. And this fear of having a seizure, and also when they're out with friends, they can be worried that if they go to something and they have a seizure, they're going to ruin that event or activity for their family and friends. So all of this really significantly narrows their world. They really limit their interactions and they stop enjoying the things that they used to be able to enjoy.
Right, right.
And I'll add also that these unpredictable aspects of having epilepsy can contribute to a sense that one has no control. So the sense that there's an external locus of control, meaning that the individual is not in control of what happens to that person. There's some other force acting, and that's a very disempowering and demoralizing experience to have. So I think we're going to talk a little bit more later about strategies for retaining and building a sense of control in a circumstance where we are it's not always clear how much internal control a person might have.
Right, right. Okay, so in some circumstances, we talked about, potentially having a seizure in public, but in some circumstances, a seizure can actually be psychologically traumatizing. What are some of the potential consequences of such trauma?
That's a really great question. We see this in many different types of medical diseases where the diagnosis or a medical event can lead to a traumatic experience that can then lead to symptoms of post-traumatic stress disorder, things like new diagnoses, and in the case of epilepsy, if the event led to an injury or if it came at a time that led to the fear of death or serious bodily injury, that in and of itself is enough to trigger possibly symptoms of post-traumatic stress disorder. So for most people, they will resolve those symptoms, and it's not uncommon for people to have some symptoms early on in the first 30 days or so after a traumatic event. And we can help people recover from that traumatic event by encouraging them to continually reach out to friends and talk about it rather than trying to avoid it. Sometimes there's a sort of a natural propensity to avoid anything that's associated with that traumatic event. But if we encourage people to gradually expose themselves to the environment in which the traumatic event happened and encourage them to think about it in a way that feels safe and they can find ways to empower themselves, we can help people avoid the development of full-blown post-traumatic stress disorder. And also trying to find ways to integrate the trauma into one's life in a way that it's more of a cognitively accessible memory as opposed to a physiologically traumatizing memory. And that happens through the process of talking about it with people who are supportive and caring in our lives.
Right. And because there is sometimes an overlap between epilepsy and psychogenic non-epileptic seizures, do you find that in cases of people who had epilepsy first and then go on to develop also additional psychogenic non-epileptic seizures, is that typically related to trauma related to the epilepsy, or is it related to more of an ongoing stress related to the epilepsy, or what are some different patterns of that explain that association?
That's a really good question. It sometimes is hard to pinpoint exactly what the trauma might be that's leading to PNES, but as you point out, we do see a very, very high percentage of individuals who have PNES also have a trauma history of some sort. And it could be, as you said, it could be related to the epilepsy itself, or it could be related to childhood traumas or a more proximal trauma like a car accident. I think we need to kind of keep an open mind about it and encourage compassion and treatment as appropriate, because actually there is good treatment for post-traumatic stress disorder, so that can help mitigate the potential risks.
Right. Okay, so another common theme in epilepsy is the concept of loss. And this can include loss of independence, loss of confidence, loss of security, loss of particular skills or abilities, restriction of activities, job loss, and much more. So can you talk about loss and the adjustment to it and how that contributes to depression and anxiety?
Yeah, these losses that you talk about are very common with patients who have seizures when they're not well controlled, and this often contributes highly to depression and anxiety. Part of it, too, is when your seizures aren't well controlled, you're not able to drive, and this can also play a big role on patients' mood and mental health as well. Part of it's logistics. We don't have a good public transportation system, but the bigger piece of it is psychological, that many people equate driving with independence. So when you lose that ability, it has a big impact. And not only that, but then because you still need to get places to do things, you become really dependent on other people for transportation. And that's a significant, adjustment to be made, around that. And there can also be times when people had jobs and careers where they were able to do those careers and have those skills for it when their epilepsy and seizures were well controlled. But with the restrictions placed when seizures aren't well controlled, sometimes those jobs and skills that they had, they're not able, to use. And so that loss of job, that loss of, for some people, purpose, that being able to provide for their family, it's a huge loss, and that has a significant impact on depression. And, part of my role in the clinic is when people are experiencing these things, primarily it's over the phone, but to problem solve with them about ways to gain independence and adjust to some of the losses that they are experiencing. And therapy, plays an important role in some of this adjustment, but sometimes it's also just about problem solving around, ways on their own to increase the independence, with the life that they're living right now. For some, examples that I have, patients sometimes are in their homes and they feel like, now they're very dependent on other people because they've lost independence, that their seizures are so bad that they're not able to be alone in a room, that there's always a friend or family member with them. And all of these things vary person to person based on their seizures, but sometimes it's talking about, is there a possibility that, for part of the day they can be in a different room, with doors open. Sometimes this is possible. Sometimes with their seizures, that's not a possibility. But sometimes when lives evolve around the seizures, then the roles within the family can change some, and there can be a caregiver role. And so sometimes there, maybe families with good intentions that are taking on more duties than they need to. Maybe there are some things that, somebody who has epilepsy can still safely do and can contribute around the house that, helps them to give them, a sense of purpose, a different way for them to contribute to the family. And so sometimes it's talking about this and figuring out if there's, ways to do things like that.
Right. Another key contributing factor to depression and anxiety that's really not unique to epilepsy is our thought processes. So our internal monologue or self-talk has a powerful influence on both our emotions and behaviors, and this is a major focus of cognitive behavioral therapy, which is probably the most widely used therapeutic approach among mental health professionals. Can you give an overview of how our thoughts, emotions, and behaviors are connected, and some examples of harmful thought processes that you often see in people with epilepsy?
Sure, yeah. So cognitive behavioral therapy is based on the idea that our thoughts, which we have about 60,000 of them each day by some estimates, influence the way we feel, and that in turn influences what we do. So the goal of cognitive behavioral therapy is to identify thought patterns that might not be constructive and facilitating the type of life and well-being that we're aiming for, and to intervene disrupting that cycle. So it could mean coming up with an alternative thought, or it could mean getting up and moving around so that our behavior then channels back into changing how we feel, and then we can adjust how we're thinking about things. One of the simple ways of thinking about this is cognitive patterns of thinking that are sometimes called cognitive distortion. So I don't love that term because it sounds judgmental, and we all do these things. So there are patterns of thinking like catastrophizing or overgeneralizing or taking things personally or focusing on the negative instead of on the positive. Those types of patterns of thinking, we'll all catch ourselves doing that at some point or another, and we can we can catch ourselves and then change the way we're thinking. A very simple example of that would be, is the glass half full or is it half empty? We can choose to see the glass as half full if we want to. And there may be people who are trained to think in certain ways because of the environments that they grew up in. I think Najda's going to talk a little bit about epilepsy in specific.
Yeah, some examples that I've seen in our clinic and talking to people because of the losses that we've, already touched on, and their lives have really changed. Sometimes I'll hear people say things such as, I have no value, I see no purpose to being here, my family would be better off without me, I'm a burden to my family, I'm not likable, I'm not adding anything to my family. So as Lisa was saying, there's, we all have these different thoughts in different moments, depending on our circumstances, but the good thing about, the behaviors and thoughts and feelings being interconnected is that by changing one part of that positively, it can impact the other parts. So there's a lot of limits and restrictions that are placed on people with epilepsy, but there's still ways to get, quality of life while still having, seizures even when they're not well controlled. And so it's also about looking at, this in perspective. These losses that people experience have a big impact on their individual identity. And so that's a key piece there as well.
Right, definitely. So there are also a number of environmental or systemic factors that can contribute to poor mental health among people with epilepsy. Discrimination, lack of employment opportunities, lack of reliable public transportation, like we've already mentioned, gaps in health insurance coverage, or other failures of our health and human service systems can all further contribute to social isolation, frustration, and a sense of powerlessness. Can you talk more about this and what people with epilepsy can do to deal with such huge and seemingly intractable societal issues?
Yeah, there are many environmental and systematic factors as well as failures, as you mentioned, of the health and human service systems. In terms of healthcare, more advances are being made in terms of telemedicine, where people can be in their own homes, on their phones or computers, and have a video conference with various types of health professionals, not just doctors, but other health professionals as well. And for some people who have a Medicaid HMO plan, do have a medical transportation benefit under that will take them to doctor's appointments, as any medical appointments. So doctors, dentists, even therapists, are also included in that. In terms of, jobs and careers that people had sometimes, as I mentioned, with the restrictions, jobs that they were able to do before they're not able to do, or maybe they're having a hard time figuring out with the restrictions that they have what kind of work they're capable of doing. One resource that I talk about with patients is Michigan Rehabilitation Services, which is a free program through the state that provides job training and education for people, and it also helps them to do job searches, and so that's, one way of kind of trying to get back into the workforce and trying to gain some of that power back is if you can't do one thing, looking to see what skills you can get, what could you do. And then for people who are working and have seizures, there is rights that they have protected under the Americans with Disability Act of 1990, commonly referred to as the ADA, where if with accommodations for their seizures, they would be able to perform the jobs, then they've got rights protected to allow them to do that or to put some different accommodations in place. But sometimes there are just things that are out of our control. And so sometimes focusing on the things that are within our control can help. such as pursuing these different job training and skill opportunities. People, can still, with all of that, face, discrimination in the workforce and in other places as well. Again, that part is out of our control, but how we respond and our reactions are within our control, as well as knowledge of rights, such as protection under the ADA. And then I also refer a lot of people to your organization, the Epilepsy Foundation of Michigan. I think this is a great resource. And there's also phone programs that you have, Project Uplift, PACES, Call and Connect. Those are all programs that I think can help people feel less isolated. People know they're not the only person with epilepsy, but I feel like being on those calls can kind of reaffirm that and help them, to see that, as well as get connection to other people, gain different skills and resources and knowledge.
Right, thanks. Some of the systemic problems can also serve as barriers to obtaining mental health care. So what do you see as some of the biggest barriers to accessing appropriate mental health services?
I think the biggest one is insurance. Finding a therapist that's accepting your insurance, having enough insurance coverage. Even with insurance coverage, sometimes the co-pays then can be unaffordable, for people. In terms of finding a therapist, I think it's important to find one that has expertise as well, that's accepting your insurance. Often it's hard to find a therapist who says they've got experience working with patients with epilepsy. And so one of the things that I recommend for people is to find a therapist who has experience working with people who have chronic health conditions, which is, skills and experience that's relatable to epilepsy, although not exactly, with epilepsy. There can also be challenges in terms of gender and cultural beliefs. And sometimes just because you find a therapist, who may have some expertise, not every therapist is right for every patient. So it's also important to be able to feel like you've got a good connection with that therapist and that it's a good fit. And I always recommend for patients to give it at least a few sessions before deciding that, it's not that right, fit for them. And the other thing is, again, back to the telemedicine in the mental health field, we're also making advances in that, and there's more therapists who are able to do that again through video. So then again, this eliminates a transportation barrier for people.
And in terms of telemedicine and mental health services, how is most of that offered through through health systems, or is some of that offered? Are you familiar with whether that's offered through the community mental health system, or I guess what's the scope of the availability of telemedicine services?
Yeah, I know that through the health systems that it's advancing. I'm not sure about community mental health itself. I do know that different private therapists, as well as some nonprofits in various communities, are going more towards the telemedicine. So I think it's not just the big hospital systems, but it is some local agencies that are working on this as well.
And have you run across any insurance barriers in terms of paying for telemedicine, like a reluctance to pay for that as opposed to face-to-face care?
I think it varies, in terms of insurance, but I think more and more insurances are getting on board with this and authorizing it, but it's still more in the forefront. So some are, more likely to cover it than others, and it's something even here at Michigan Medicine where we're starting to do and trying to figure out, barriers to that, and and working with different insurance companies. Starting to happen more and is coming up, but they're still trying to, all the agencies, including Michigan Medicine, trying to figure some of that out.
Sure. So having talked about some of the factors that can contribute to depression and anxiety disorders among people with epilepsy, now I want to transition to talking about some of the day-to-day approaches that can promote emotional well-being really for anyone, including those without epilepsy or those without diagnosed mental health disorders. So a major source of such strategies is the field of positive psychology. So can you talk about the basic principles of positive psychology and some of the related practices that people can integrate into their daily lives?
Positive psychology is a wonderful field that's dedicated to understanding well-being and what enables individuals to thrive. It's contrasted against psychiatry and general psychology, which focus more on psychopathology, on mental illness and what's gone wrong. So Martin Seligman, who was the grandfather of the positive psychology movement, wanted to look at the scientific study of what makes life most worth living, which is really wonderful because now he's been doing it, he and many others have been doing it for decades. So we do have a lot of information about what can help us all live happier, healthier lives, simple strategies that can be employed on a daily basis. So some of the things that are the easiest to employ, a gratitude practice, for example. This is often done person to person or through a journal, and the idea is to identify a few things a day. You can pick a number, 5 things per day that a person is genuinely grateful for. So one might do it at the dinner table. Each person goes around and names a thing that they are grateful for. And by doing this, what it is found is that people tend to start to shift their focus towards a more grateful stance in life, which changes how they feel inside and contributes to more happiness and a greater sense of well-being. Another element of positive psychology is this notion of flow. This was, the phrase was coined by Mihaly Csikszentmihalyi, and we can put some resources on the website attached to this webinar so you can read more and learn more about it. The idea is that when we engage in an activity that we really love to do, we sort of lose time and we change our physiology, actually. It's kind of equivalent to being in the zone like in a basketball game, the idea that a person is completely engaged, and there are many, many different ways to get this feeling of flow. And the wonderful thing about positive psychology is that each one of us may have a different way of inducing it, so it leaves lots of room for exploration. For some people it might be listening to music, others dancing, others creating art. For some people it might be spending time with loved ones. So another element of positive psychology that's related is the notion of optimism. And I want to clarify here that we're not talking about Pollyanna fake invocation of positive attitudes that don't feel genuine, because that actually feels very uncomfortable and is quite distressing. And even the notion of thinking about a glass that's half full or half empty, as I alluded to earlier, if that doesn't feel right for us, we don't want to force it on ourselves. We want to aim for authentic positivity. So to genuinely look and try to find something that we can think about in a positive way, or a way to think about a situation in a positive way. And some people are really, really good at this, even in the face of dramatic medical challenges and other environmental challenges. They're able to find a way that they can turn a negative situation into a growth or a lesson. And not always so easy to do, but when we're able to do it, it really is so transformational. And there is a lot of data that shows that thinking positively this way enhances our well-being. Other things that come from positive psychology, the notion of helping other people. There's a lot of data about how performing acts of kindness towards others actually boosts our well-being. There will be many different reasons for this. It feels good to help other people just on a simple level, right? And it takes us out of our own headspace if we're struggling with things on our own. Being able to help someone else can give us the joy of seeing them do well and also remind us that we are useful and valuable. Another element of positive psychology is the notion of meaning and purpose. And again, it's not the same for all of us, and that's part of the beauty of these learned lessons, is that maybe for me, taking a walk in nature gives me a sense of meaning and purpose when I do it with my niece or nephew. For someone else, Maybe it's going to the bowling alley and spending time with friends there. And we can each explore these things on our own and find what works for us.
Great. Those are some great examples. So interpersonal relationships can also be a source of stress and a source of support and happiness. Can you talk about the importance of social engagement and what people can do to ensure that their relationships are more helpful than harmful?
Yes, as we've discussed, social isolation plays a big role in people feeling depressed. So we're, encouraging, social interaction. It's something that we all as human beings need. But this can also, as you said, it can be both, a source of support as well as stress. And so sometimes it's looking at the interactions and relationships that we have. Communication is key in all relationships. And there's different types of communication and styles. And a communication style that can be helpful both in terms of communicating as well as conflict resolution is assertive communication. This type of communication, you're using I statements. So, when conflicts come up or when things, something happens and you're feeling upset about it, it's important to use those I statements to talk about your feelings, your thoughts, your perceptions of how something went. And this helps to, so that you're honestly expressing what you feel, and it also helps because you're respecting the other person's perspective and what they're feeling and that might be different. And by using the I statements, then both people can hopefully get their needs and voices heard. And by avoiding the you statements, people are less likely to be put on the defensive. The I statements, and anything helps communication, with everything.
And I'll add that these social contacts in our lives actually are becoming more and more prevalent in the literature about health now, because we're realizing that good social connections defined by the individual. It's not quantity, it's quality. So do you feel like you have someone who you can talk to when you're going through a rough time? Having those people in our lives, maybe it's one person, maybe it's two or three, can actually change our physiological experiences of life. So our hormone levels change when we're around people that we feel safe and comfortable with. And there are also information flow changes that happen when we have a good network of friends who can tell us about medical advances or can remind us to go and get our blood sugar levels checked, remind us to go to the doctor for our various needs or to get something checked out. And these social relationships are actually associated with greater longevity, longer lives, and better quality of life. And so as Najda talked about, using these strategies to improve our relationships with others can really have an impact on our well-being. And one of the ways to kind of think about nurturing these positive relationships is to think about how we feel after spending time with specific people. There may be times when we're with someone and we feel drained after we were with that person. Or maybe vice versa. Maybe there are some people that we spend time with and we feel great afterwards, but they feel drained. So keeping an eye on those kinds of things can help us adjust and balance so that we can find a community, find a network that we can be part of, where we feel really like we can be ourselves and feel totally accepted.
Right. So stress is an inevitable part of life, but how you manage it can help determine how much it affects our emotional well-being. We've talked about some of the approaches to managing interpersonal stressors, but what are some other day-to-day approaches to minimizing stress?
So I wanted to highlight that the literature shows that if we have some level of control over what's happening to us, if we're able to predict what is going to happen to us, and if we have an outlet for releasing stress, these things can decrease the physiological wear and tear on our bodies caused by stress. So we can think about various ways to find measures of control, as Najda talked about earlier, even when we have challenges. And actually, even just the perception of having control can help reduce the wear and tear on the body. So we can use a concept called cognitive restructuring, thinking about things in a different way. So instead of saying, well, there's nothing I can do here, to stop and think about, well, today I can get up and go for a walk for 5 minutes, even though I don't have time to go for a 60-minute walk, which is what I would really like to do. And other things we can do to help balance the unpredictability that comes with epilepsy would be to set up routines and to practice things also like mindfulness, so that when our routines are disrupted, we are able to adapt. And we're going to talk a little bit more about mindfulness in a minute. The other thing is outlets for stress. So that's a wide open field. Again, it might be different for each one of us. For some people, it might be knitting or building things or singing or spending time with pets or volunteering at a school or a nursing home. And we want to each think about how we can optimize these elements in order to increase our well-being.
Okay. So, yeah, you did mention mindfulness and relaxation techniques, so we'll talk a little bit about that. So there are really a wide range of relaxation techniques that, with practice, can become powerful tools in reducing stress and promoting mental health. So can you talk about some of those techniques and how to access them and the importance of regular practice?
Sure. So to clarify what we're talking about here, the counterpart to stress, the stress response, is the relaxation response. And that's a term coined by the cardiologist Herbert Benson, who noticed the health benefits of relaxation, and he's been doing research on that for decades now. The good thing is we can activate the relaxation response through our minds and our actions. So let's talk about mindfulness. That's a term that is becoming more and more popular and, again, also associated with positive health benefits. So it's basically a mental state achieved by focusing one's awareness on the present moment and building the ability to live in the present moment and let go of anything else that might be in the future or the past that could be distressing to us. So there are many actually online apps and online tools to learn more about mindfulness. One of the things that's often used is thinking about sensory experiences. So what do I hear? What do I see? What do I feel? What do I smell or taste right now here in this moment? By doing that, it can pull us back to the present moment and give us a tool to avoid living too much in the past or too much in the future. There's an experiment that people will do with a raisin where they put the raisin in the mouth and, well, first you look at the raisin and then you feel the raisin and then eventually end up putting it in the mouth and feeling it then inside the mouth and realizing that just a small raisin can have so many different elements to it that we don't pay attention to when we just take a handful of raisins and pop it into our mouth. So mindfulness is one way that we can invoke the relaxation response. Breathing exercises are another. So one of the most popular breathing exercises is diaphragmatic breathing. It activates the vagus nerve, which again stimulates the relaxation response. There are lots of online tutorials for that, and we'll try and put some links on the website for that. It's basically the way that a baby breathes when lying on the back. And And we teach it by having one hand on the upper chest and one hand on the belly. And when breathing in, we aim to have the belly move out. And that allows for as much air to enter into the lungs all the way down to the base of the lungs, because sometimes when we're stressed, we tend to breathe more shallowly and we don't get the full benefit of deep breaths, which can lead to overall activation of the stress system. There are many other breathing strategies too, lots of things online. Progressive muscle relaxation is another strategy for pressing the reset button. I use this a lot with folks in the hospital. There are two versions. One is passive progressive muscle relaxation, and the other is active progressive muscle relaxation. The active version involves clenching the muscles one by one, starting with the toes or starting at the top of the head with the face, and then releasing the muscles. The version that I use is the passive version, where a person closes their eyes and they just imagine letting go of the muscles in the top of the head, in the forehead, in the neck, and the shoulders. And there are neurological reasons why this can be very relaxing, even just the suggestion of relaxing these muscles. And for many people, it can help them snap out of a difficult situation. And if we do these things regularly on a daily basis, we can avoid the buildup of stress over time. Guided imagery, meditation, and hypnosis are some other tools that can be used. There are apps such as Insight Timer online, which has, I think it's now 20,000 different guided imagery and meditation segments that one can listen to. And then there is also yoga, which can be done alone or with other people. And that is kind of a combination of a meditative and a physical practice, and it's related to mindfulness. One of the key things there is that there's no judgment involved in it. And it can also be a nice way to kind of reset and decrease stress in the moment.
Great.
Yeah, that's about it for now on that.
Yeah, and can you just briefly talk about why practice is important?
Oh, yeah, good point. So the more we practice, the more we develop habits, and it becomes easier and easier to invoke the relaxation response. It might sometimes be discouraging if it doesn't work right away, but if, as Najda said, if you give it a chance, keep trying, it can actually become a really reliable source of relaxation for us over time. Right,
and it doesn't take much. I mean, sometimes even 5-10 minutes a day, if you just devote that to practicing one of those, whichever technique you find works best for you or you find easiest to fit in to your schedule. But that regular practice can make it become almost an unconscious response, the more you do it. So,
absolutely.
Great. So I think everyone knows that healthy sleep and healthy eating and exercise are good for you, but I suspect that many may not realize just how important these behaviors are for mental health in addition to physical health. So in addition, knowing that a particular behavior is good for you does not always translate to actually adopting and maintaining that behavior. So let's start by discussing sleep. What are some of the specific mental health benefits of proper sleep habits, and how can people overcome some of the common barriers to sleep?
So there was a wonderful book written a few years ago called Spark by a physician who has studied the cognitive effects of exercise. Sorry, that's a different topic. So about sleep, they're actually very, very similar. The benefits of exercise and sleep are very closely related. So mood is improved when we get good sleep. Reaction times are improved. We have more mental clarity, ability to think clearly, that is, and solve problems. Our patience and our ability to regulate our emotions is much improved when we get good sleep. We're less irritable, we're less stressed out, less anxious, we have more energy, and there's also data about inflammation and how that relates to mental health. There are hypotheses that are gaining more and more data about inflammation leading to depressive symptoms. And getting good sleep can decrease inflammation. So how does one get good sleep? There is a concept called sleep hygiene. It's similar to dental hygiene. So we brush our teeth so we don't get cavities. So with sleep hygiene, there are certain things that we can do on a daily basis that can help us improve our sleep and regulate our circadian rhythms. So, for example, exercising to promote good sleep, not too soon before bedtime, but earlier in the day can help us regulate and get a good night's sleep. Staying away from caffeine later in the day, making sure that the sleep environment is pleasant and peaceful, and establishing a regular, relaxing bedtime routine around the same time each day, and then trying to wake up at the same time each day. These kinds of things, along with many others, and we can again provide a link to more information about this, can help us establish good habits that just, as you said earlier, Russ, happen automatically once we start to do them over time. And some of the barriers to sleep are things like anxiety or worries, or sometimes pain can get in the way. So there are many different ways that we can address these kinds of problems. There is a therapeutic treatment called cognitive behavioral therapy for insomnia, and that's considered one of the frontline treatments in the case where there's not a medical explanation for the insomnia. We can use things like the relaxation strategies we just talked about. There are many apps now. We can use distraction, reading a novel, and these types of things can help with simple insomnia. There are also things like hypnotic techniques that can be done, and in general, we recommend casting a wide net and exploring many of the different behavioral strategies that might be available, and of course consulting with a doctor as needed in case there is some sort of medical problem, for example, sleep apnea or another sleep disorder, for which there might be other interventions necessary.
Right, right. So there's probably less research on how specific foods or nutrients impact emotional well-being, but what are some recommendations that we can be reasonably confident will help? And also, what are some common barriers to healthy eating and strategies that can be used to overcome those barriers?
Sure. So I think everybody has heard about having a balanced diet, right? I like to think of nutrition as analogous to the fuel that we put into our system or into a car. If we put diesel into a machine that needs oil or gas, we're not going to get good results. Same thing happens with our nutrition and our well-being. There is a physician actually who has he's a psychiatrist who has devoted his career to studying integrative nutrition and how it affects psychological well-being. So we'll put a link to his website. His name is Drew Ramsey, and he's doing a lot of really interesting work about different nutritional elements that can improve inflammation, or that is decrease inflammation, and ways to get a balanced, varied set of nutrients depending on whatever the issue might be at hand. And I recommend consulting, of course, with one's doctor and a nutritionist. And then once one has a set of goals, one of the ways to help reach those is to try to tie them to things that one does on a regular basis. So if I'm trying to have more more vegetables, it might be too expensive to have fresh vegetables, so I might try to get frozen vegetables. So I might make that a regular item on my grocery list so that I can automatically do it. Another barrier is emotional eating. Sometimes we eat because we're stressed out. And so if we can invoke some of the other tools that we've been talking about today to avoid emotional eating, we can stick to our goals a little bit better. There's a story that I heard about Bill Belichick, who is the coach of the New England Patriots. Apparently he keeps the objection flag in the bottom of his shoe so that when he is getting upset, he thinks about whether he wants to pull that objection flag out of his shoe so that he gives him some time to think. The same could be done with emotional eating. So I once knew a person who put a cinder block in front of the refrigerator, and every time he was going to go to the refrigerator, he had to ask himself, am I eating because I really need to, or because I'm hungry, or am I eating for a reason that I don't want to be eating? So he would have to overcome that barrier, the cinder block, in order to get into the refrigerator. So things like that can be helpful in terms of allowing ourselves to reach our goals.
Right, and remembering mindfulness too, just another, the idea of mindful eating can be really helpful actually, because a lot of times people are in a rush and they'll just, shovel food into their mouths and not even really notice what they're eating. So just the idea of taking one forkful at a time, chewing it thoroughly, like thinking about the flavor and the texture and the smell, and all of that can slow you down, and you can get the same level of satisfaction out of a smaller amount of food if one of your goals is to, reduce portion size or something. So so that can have both the benefits of mindfulness and also the benefits of, of healthy eating. So, but go ahead, Najda.
Right. I was just going to say, Lisa had talked about some of the barriers, and again, finances come into this. We're told to eat healthy, but the fresh fruits and vegetables are more expensive. So like Lisa said, going for the frozen vegetables, is one way to get around that. Sometimes there's, local food pantries where you can get some of that as well. Or sometimes, it's seasonal, but sometimes there's community gardens where you're able to plant and get some vegetables that way. So trying to think about, different ways that you can try to accomplish that.
Right. So exercise and physical activity also have a tremendous mental health benefits. Can you review some of those benefits and provide some tips for integrating more physical activity into your daily life?
Sure. So the benefits are huge. Exercising can make a person feel happier, can help with weight loss. It is good for the muscles and the bones, increases strength, increases self-confidence, can reduce the risk of chronic disease. It can help with the brain and our cognitive functioning. As I alluded to earlier, the book called Spark is about brain health and exercise. It can help with relaxation and sleep quality. The benefits are endless, actually. And so I think we jump to then tips for trying to get more physical activity into our lives. Things that are enjoyable and that we're not thinking of as a chore or as exercise can be helpful. For example, team sports can help us find a way to move that feels good, and working together toward a common cause as a member of a team can be excellent for our long-term happiness and our sense of connection to others. There's also a lot of data coming forward now about green exercise and the benefits of being outside in the outdoors. One of the recent episodes of The Hidden Brain talked about this specifically, and being outside in nature also has spiritual benefits. Spiritual meaning feeling that we're part of something larger than ourselves, which is another element of well-being. So there are various ways that we can capitalize on that. For some people, it's walking to work and looking at the trees on the way to work. For other people, it's taking a plot in a local community garden and growing flowers, and that also gives exercise, as opposed to making it a chore. But again, there's no one-size-fits-all. I think that's all I'll say because I'm looking at the time.
Sure.
Oh, and taking, again, small habit changes, taking the stairs when we can, parking away from the grocery store front door gives us a little bit more time to walk, and then doing things with friends too, and setting measurable and achievable goals rather than large goals that might be too daunting.
Right, and there's like a couple examples you gave, talk about how doing one activity can integrate some of the other activities that we mentioned earlier. So social activity and exercise together, you can get double the benefit, or mindful walking, you can get the stress reduction benefits of mindfulness combined with walking, paying attention to the trees and the birds and the noises and the way the wind feels as you're walking, all of those things. So in many cases, it's possible to address or have two of these activities happening at the same time. So great. So one last thing I wanted to talk about before we open it for questions is the idea of social media and all the access to information that we have. So that has certainly has some very clear personal and societal benefits to have access to all of this information and to be able to communicate in so many different ways with our friends. But also information overload and excessive use of social media can have a significant negative impact on mental health. Can you talk about this impact and how to manage it, particularly in children who are kind of learning to navigate this new world?
And social media can be very beneficial, connecting to people. There's online support groups, there's different blogs, there's increased information, which is very helpful. But it's kind of like with anything in life, too much of it for both adults and children can be harmful. So it's about finding that balance. Having some online connections are good, but balancing that with in-person connections, because the online connections are helpful, and can add to our quality of life, but the in-person connections and seeing people, being in the same room with people is really beneficial as well. And sometimes when we're looking at social media, we get a snapshot of one moment of one person's day. And people, when they're posting that, they're picking their best moment of that day, and showing that. And so when you see that best moment of someone's day and think their life is all like that, their whole day is like that, and then we think about our day and think, well, my day was nothing like that, then we can feel, depressed comparing ourselves, to somebody else, and sometimes on the flip side of that, sometimes the online groups are helpful, but sometimes there can be people in there who are very negative and depressed, and reading those posts can also drain you and make you feel down. This goes back to what Lisa was saying in terms of when you're spending time with people, do you leave there feeling drained or do you leave there feeling uplifted? So sometimes just reading negative online posts, can also drain you or make you feel more down. And then, there can be bullying online. We've all seen different news reports about this. And bullying is a concern, for all of us. It happens to adults as well as children online. But children are more vulnerable to this. And so I think with children, it's important to talk with them about two things, about, one, not being a bully online, but also if they are being bullied, what to do, what, are the response to that, who can they talk to? And, for social media for children, again, it's about balance. It's about setting limits of how much time they can spend online, but it's also about monitoring their social media, talking with them about them having online access. That's a privilege. It's not a right that they have. And if it's abused, that it can be taken away. Different people have different perspectives about that, but I think if children see this as, their right, they can spend as much time as they want, they can say whatever they want, that's not really within kind of societal norms. It's happening, but for the well-being of everyone, setting limits, is important. And, for, children, it's also important for their parents or the adults in their lives to know what social media sites they go to, what social media apps are on their phone, what are their screen names. And it's also important to talk with them about the fact that those are going to be monitored, and then it's important to monitor, and if things come up, to talk with them about it. There can be things that happen, and even if they're negative, about, a teachable moment, about learning from that. So I think with children, it's important to monitor what they're doing, to be a role model for it as well, and to kind of limit some of it, because this is new to them. They are navigating it. For some of us adults, it's new as well. This, technology is going to keep coming up. There's going to be different sites, different things, and we just need to try to keep up with it the best we can and help the children.
Right. And I also think just as far as like information overload, that's something I, sometimes fall victim to is, reading the news and sometimes I just have to take a break and say, I'm not gonna read the news for a while. I'm gonna, or we went on vacation and I didn't check the news at all, and it was like hitting the reset button. It just, kind of wiped away a lot of this building tension that, was associated with all of the things going on in the world that are distressing. So I think just taking a break periodically can also be really helpful. All right, so before we open it up for questions, do either of you have any closing thoughts on the topic that you'd like to share, or do you just want to go ahead and open it up for questions?
One thing that I wanted to mention is that we've talked about a lot of different resources and tools and different things to try to incorporate into your life. And I think something about that is it's important to start small. Just take little steps and then to build on those, because sometimes we think, oh, I can do all three of these things at once, I'm going to incorporate it, and then when we're not able to do that, it's a setback, and we're like, well, I can't do any of it. So I think something that's important is to really start small. Incorporate one thing. We've talked about practice, how that makes it easier. Once you've incorporated one small step and you've gotten that and you felt, if you incorporate it into your life, then build upon that and do another small step. So I think just, thinking small is going to be really helpful. Right.
And I'll just add to that that there's no single recipe for well-being. A colleague of mine likes to talk about life as a buffet of options that can contribute to our own personal menu. So we can try what is of interest and go back for more of whatever we like. And to keep an open mind about what might work today might not work tomorrow, and then might work again a year from now, or vice versa. And so giving ourselves room for adaptation as we change from day to day over time, and as our circumstances change around us, we might find that we need something different. And basically, there's really no right or wrong at all. We want to be able to find circumstances that work for us.
Great, thanks. Yeah, I like the buffet analogy. That's good. Okay, so we'll go ahead and open it up for questions. And I do remind people, too, if you are not asking a question, please have your phone muted. And then you can unmute if you do have a question or comment. Okay, so just a moment. Okay, who would like to get us started with a question? We've got 20 minutes left, so got plenty of time for questions. Anyone have a question? Or if no one has questions, does anyone have a comment or a particular strategy that you've used that's been particularly helpful in promoting emotional well-being?
Yeah, this is Matthew Miller. One way, one way that helped me, I saw a psychiatrist. I don't know who he was, but he said, do one good deed a day, and just one, and you will feel better. So that, I've done that quite often, and it does help me. I just do one, like opening the door for a person, or something like that. Just something simple for just.
That's a great suggestion. Yeah, along the lines of positive psychology and helping others, and it also just gets you thinking about, again, outside of yourself and thinking, connecting you with a larger community. So that's a great idea. Thanks, Matt.
Yeah.
Other comments?
It's also a great example of how a simple thing, one small behavior, can change our outlook and change literally how we feel and how we think in that moment. It's so nice to hear you say that you're adopting that, because sometimes I think we think that we have to make big changes in order to make a difference, but to be able to notice and be mindful of that one moment where you choose to open the door for someone, you just changed how they felt and you just changed how you felt, which is a beautiful thing.
Thank you. You don't have to have epilepsy for that either, so.
Nope.
Right, and that's true about most of what we've talked about today is applicable to anyone really. So, and people who maybe even consider themselves to have a really good mental health, it doesn't mean that you can't still continue improving that. So, other questions or comments?
Yes, hi, this is Maria Bowles.
Hi, go ahead.
Okay, just wanted to make sure, thank you. So I have a 14-year-old daughter who previously had absence epilepsy, but this year, unfortunately, started having the tonic-clonics, and so now more of a full-blown, if you will, noticeable to others epilepsy. And although we believe we may have it under control with medication, we certainly still struggle with the uncertainty every day of whether or not she may end up, having a grand mal seizure unexpectedly. And it's been an adjustment for us as a family trying to figure out what we say now is our new norm, something that we, of course, didn't have much experience with until her having her grand mal this summer. And so she's starting high school and doesn't have any friends that happen to have epilepsy. So it's everything that you said today really resonated with me, and I appreciate everyone here taking the time to share, because this emotional well-being is a challenge for us as a parent of trying to figure out how, where she's at with all of it. She can say one thing, but how she really feels is a challenge for us, of wondering how she's really adapting to this and her, at this point, lack of independence. And you mentioned that, like, friends are starting driver's ed and things like that, and she can't do that yet. So I've tried to encourage her to, look into blogs or that for teenagers to try to get her to engage possibly with other epileptic teenagers. And she's just not ready to do that yet, from what I can tell. But do you have a recommendation of a particular place to kind of point her to start? Because, as you mentioned, there is so much out there. And I've joined some Facebook groups, but it's a bit overwhelming, actually, because I find that, if anything, there's more people having tough days that they're posting versus good days. And so I'm trying to just look for others that we need as a family to learn how to kind of adapt to this new norm, and for something for her in particular, for her to have a group to reach out to or to try to relate to, I think would be really helpful.
Well, one thing I can recommend, I don't know if she's done this yet, but is our Camp Discovery. Are you familiar with that?
No, I'm not.
Okay, so this is our summer camp for kids with epilepsy, and she's how old?
She's 14.
14, okay.
So she'll be 15 in December.
Yep.
So I think, now that you mentioned that, I do believe she's probably aging out soon.
No, she would be eligible to attend Camp Discovery for this coming summer, so for 2020. So that's for ages 7 through 15, and then after that, for ages 16 and 17, there's a separate camp called Solstice Camp, and that is actually for not only for people teens with epilepsy, but also teens with other chronic health conditions. So that's kind of a nice stepping stone to kind of broaden their community. But those, I mean, I can't say enough about how impactful those experiences can be, not only the actual camp itself, but just the networks that are built by attending those camps. That, you know, kids exchange phone numbers and emails, and you know, have a support network that they can access throughout the year. So even though the camp itself is only 5 days, the network, the social network that's built, and some of the skills and that they build, and some of the confidence that they build can last throughout the year. So that would be a great starting point. Other suggestions of that others may have?
This is Najda. I don't have any off the top of my head, but what I could do is, if you would be willing to give Russ your information, I could look for some options and then either give that to Russ or get your information and get that directly to you.
Yes, that would be great. Thank you very much.
Okay, and we do have also more immediate, we do have our Wellness and Epilepsy Conference coming up in November, so that would, there is a kids conference day camp there, which is pretty much ages 5 through 15. So, and that's for kids with epilepsy siblings, and also kids who have a parent with epilepsy. It's a full day of activities, and so that might be another opportunity to meet some other kids who are dealing with similar challenges. And sometimes with the older kids, you know, we can even arrange it so they sort of serve in a hybrid role, so that they're sort of participating in the camp, but also assisting as sort of as mentors for the younger kids in the camp. And so kind of a half volunteer, half participant role sometimes works well for the older kids.
Yeah, I actually am signed up for that conference, and I've tried to convince her to want to attend the camp, the day part for the kids, and she just, I think she just, this is where we say that we are unsure where she's really at emotionally, because to her it still seems a bit awkward and uncomfortable to associate or publicly that she has epilepsy. So she says she doesn't want to go, and that's where I'm trying to figure out if there was a different way, whether like through social media, like a you know, even a blog or something to help get her kind of a foot in the door to begin to open up and share how she feels with others going through it similarly might help us. It doesn't, she's not ready yet for a outward discussion, it appears.
Sure. Yeah, and you, obviously they have to be open and willing to participate, or else it's not going to really be helpful. So yeah, some sort of stepping stone, like you said, might be helpful. So other questions? Go ahead. Sorry.
I was just going to say that process of adapting can take a little bit of time, as you know, of course. And there are sometimes individual resources that could be helpful, like in the hospital when someone gets a new diagnosis. We'll often, just as a matter of course, recommend that they talk to a counselor to help cope with the new diagnosis. I don't know if that might be something that she might feel open to, but it's another thing to consider. Maybe a one-on-one environment might be less threatening, and if it's not specifically focused on the epilepsy. But hopefully over time she'll be able to open up. As Russ said, that has to come from within. We unfortunately can't do those things for others as much as we would like to. It's painful.
Okay, thank you. Appreciate everyone's time.
Okay, other questions or comments? All right, well, if we're out of questions or comments, I guess we will go ahead and wrap up the call. So I do appreciate everyone joining us today, and again, thank you, Dr. Patterson and Najda, for really an excellent discussion on a very broad topic, and I think we touched on a lot of things that people can integrate into their lives to make a difference and to really promote that emotional well-being. So thank you so much. Just as for our next Learn and Share conference call that addresses a different aspect of brain health is on October 2nd, and that is entitled Assessing and Addressing Cognitive Function in Epilepsy, and that's with Dr. Evan Tank, who's an epileptologist, and Dr. Elissa Johnson, who's a pediatric neuropsychologist. So that's on October 2nd from noon to 1:30. If anyone has any questions about epilepsy or this topic, please give us a call at 1-800-377-6226 or visit our website at epilepsymichigan.org. So again, I do thank everyone for joining us today, and thank you to our speakers, and we'll look forward to talking with you all soon.
Thanks for having us.
Thank you.
Take care.
Thank you.